It's a self-fulfilling prophecy. She has performance anxiety. She does. Because she goes, here we go again. It happened last night. It happened the night before. It happened last night a year ago. So of course it's going to happen again. You know, because nothing's ever helped. So I know it's going to happen again. So when she says that incantation, the adrenaline level starts to rise a little bit, you know, heart starts to pound a little faster, the blood pressure starts to get up a little bit, the cortisol level starts to go up, right? Stress hormones are getting up there. And then she tries to force herself to sleep. So now she's in bed, the lights are out, and she's going, am I asleep yet? How about now? Right? You'll never fall asleep if you're asking yourself, how about now? Right? So she's sure that there's something wrong with her. And she comes to you, she's really worried that maybe she's got a brain tumor or something horrible. I'm serious. People come to me thinking that they've got a tumor, you know, or MS, or maybe it was a stroke or something, you know, that there's something really terrible that's gone wrong with their body. Because no sleep aid has ever worked. And, you know, they keep, you know, and you look at the models on the TV commercials, and they're all sleeping so peacefully, and the little moth is fluttering around, and everything is beautiful, and that's not her, right? So, you know, so her story is very different from what she sees on TV, right? So, how do we fix Joanne's insomnia?
Get the clowns out of the yard.
Yeah, for starters. Right, good, that's good. Set the time for day and night. I personally have found that setting the time for both day and night, yeah, it's kind of rough on people. But setting the time for the morning is easier. Yeah, setting the time to get up. Well, if you can, that's great. Many people find they have a hard time with that because of their, you know, schedules and stuff. But I find that if you at least set the morning time, then you've given yourself an anchor point. You need an anchor point. Whether it's your bedtime or whether it's your morning time, you need an anchor point every day, right? And that is number 4 on the list, okay? The top thing, they should all actually be the same weight, I think, pretty much. You want to limit her time awake in bed to maybe 10 minutes, okay? 10 minutes, all right? You heard me. If you're awake after 10 minutes, you have to leave the bed and the bedroom.
My computer's in there.
Precisely. You knew it. And you can't go back to bed until you're really sleepy. And you can't fall asleep on the couch. You cannot indulge yourself. Okay? And how do you know you're really sleepy? Well, do you go, well, 45 minutes has gone by, so therefore I must be sleepy now? No. How can you tell if you're really sleepy? Give me some clues, guys. Yeah, you're yawning, your eyelids are heavy, you're nodding, right? So what do? You go back to bed. Yeah.
Actually, when I get really sleepy, I don't get it.
We'll circle around to that because that's you're different. Yeah.
I cannot fall asleep during the day, so I hear you about getting up after 10 minutes, but can I go lay down? I have a very bad lower back.
Mm-hmm.
Scoliosis spondylosis. Can I go lay down on the couch?
Absolutely. Just don't fall asleep on the couch.
I won't, I guarantee.
Yeah. Wait until you're drowsy. You can fall asleep. I mean, you can lie down. You can sit in a recliner or a gravity chair. You know, one of those zero gravity chairs, whatever. Do something that's not particularly stimulating. Don't vacuum. Don't do the dishes. Don't make lists of all the things that you need to do tomorrow, right? Something mundane, crochet, you know, read a history book, read John Adams. I'm reading that. I can make it through about 10 pages of that before I fall, you know, get really drowsy. Great book, but it's, you know, it'll make you sleepy. And then eventually you're yawning and your eyelids are heavy and you go back to bed. And what's going to happen then?
You're going to fall asleep.
You wish. Usually what happens is, bing, you're wide awake again. Woohoo! Right? Why? Are there vapors coming up from the mattress? Is that it?
Because the mattress is still low.
Yeah, well, we'll get to that. Yeah, the main problem is that you've conditioned yourself, right? Just like Pavlov's dog to salivate when the bell is rung, you've conditioned yourself to be awake in bed. And you have to uncondition yourself from that. That's what we're talking about here. This is behavioral therapy. We're teaching you to extinguish the association between being in bed and being awake.
Do you recommend reading in bed?
No.
Oh. No hesitation.
The bed is for sleep and for intimacy. Those two things only. No reading, no snacking, no TV, no computer, no thinking. It's for sleep.
At this point, it's great.
This is just for insomniacs. Yeah. In other words, if it works great for you, that's fine. But you're not in my clinic. Joanne's in my clinic, and it's not working for her. If it works for you, stick with it. But if it doesn't work for you, if you're up and your mind is racing and you can't quiet down, then you've got to do this. And this will work better than the pills, because the pills don't work for this. Thanks. Okay.